Hey everybody, it's Dr. Wise. One question I get fairly frequently is, is there an age that it's just too young to have a hair transplant, especially for a male patient? And the answer is yes and no. It's a little complicated. So people that have early hair loss, we're talking about what we call like Norwood 2 loss, which is to say that there's a little bit of temporal recession, not really significant. That's really common in almost all men as men transition from their teens to their 20s and 30s. That's considered actually normal. So a little bit of hair loss is completely normal, and we don't recommend transplants, especially when people are in their teenage years. We like to wait to see how much the hair loss progresses before we start going on the transplant route. That said, there's a number of things that people can do. We recommend PRP, we recommend pharmacotherapy, there's nutritional supplementation, there's other things that people can do. That said, if someone is a teenager or in their early 20s and they have a decent amount of hair loss, it's fairly progressive, we can actually do transplants. The key to doing transplants in younger people is being relatively conservative. So we don't want to try to establish a hairline that's extremely juvenile. We don't want to create a hairline that someone had, let's say, when they were 10 years old. That's not realistic in any adult male. So we have to be smart about it, and we have to strategize and make sure that we do the right thing for the patient so that they look good at this moment, but we also want people to look good as they get into their 20s, 30s, 40s, 50s, and so on. So that's really kind of the skinny on that, but the most important thing would be to give us a call, come in and see us, be happy to review your case, and we can come up with a plan that makes sense for the individual person.